Hello everyone, I did my presentation on hyperthyroidism and Graves' disease. So the thyroid is a gland that sits at the front base of the neck and it's shaped similarly to a butterfly. The thyroid is part of the endocrine system and that system helps regulate hormones within the body. A condition called hyperthyroidism is when the thyroid is overactive and it actually produces too much of the thyroid hormone. This, in effect, is going to speed up the metabolism and it's also going to speed up other bodily functions, such as the heart, which we do touch on later. 1 in 100 Americans will have hyperthyroidism. This data only applies to people who are 12 and up. If they were 11 and under, this would not be applicable. Often a blood test and imaging will be done to come to a diagnosis, and hyperthyroidism is known to contribute to fertility issues. So if a woman were having problems getting pregnant, she could be tested for this condition knowing that it causes these issues. There are some risk factors that can put an individual at higher risk. So maybe a family history of thyroid disease, pregnancy, a personal history of diseases such as pernicious anemia and Addison's disease. Type 1 and 2 diabetes also puts you at a higher risk. Some symptoms may include unexplained weight loss, heart palpitations, fast or irregular heartbeat, tiredness, problem sleeping, thinning skin, brittle hair, muscle weakness, tremors, and excessive sweating. Medications such as beta blockers or radioiodine therapy can be used as treatments. But the radioiodine therapy, it's not recommended for people who are pregnant or breastfeeding just because it can harm the fetus and or baby. Also, surgery could be a treatment for this. Graves' disease. This is an autoimmune disease, and this can cause hyperthyroidism. There is an antibody called thyrotropin receptor antibody, and that is linked to Graves' disease, leading to more thyroid hormone in the body. Graves' disease can also cause issues with the eyes, the liver, heart, bones, and skeletal muscles. Some of the risks for Graves' disease could be a family history of autoimmune disease or thyroid disease, age and sex. So women typically are at a higher risk for Graves' disease, smoking, and an excessive intake of iodine. Some of the symptoms for Graves' disease could be changes in the menstrual cycle, discolored skin, irregular heartbeats, an enlarged thyroid gland, and excessive sweating. So the goal of treatment is to halt the production of hormones in the thyroid, and some of those treatments could include beta blockers, anti-thyroid medication, radioactive iodine therapy, or the total removal of the thyroid. If this does occur, if the removal of the thyroid is something that does happen, you would probably need to be on medication for the rest of your life. So getting a diagnosis can be done a couple different ways. They could do blood tests. So the first test could be just for testing the level of the thyroid hormone in the blood, or they could test for the level of antibodies that causes Graves' disease. There could also be radioactive iodine uptake. So this is a test that's going to measure how much radioactive iodine the thyroid took in. And these are my references. Thank you very much.